The White House says it wants to make our food safer, but are they doing anything about the food that's making us sick? Well, today, the Trump administration announcing a new rule to tighten oversight of ingredients in our food. It'll require manufacturers to notify HHS and the FDA when they determine an ingredient is recognized as safe, rather than just deciding something is safe on its own. At the same time, HHS is trying to crack down on junk food. Today, the department proposing a first-ever definition of ultra-processed foods. HHS Secretary Robert F. Kennedy Jr. touting the changes at a press conference earlier today.
If you can't define a problem, you can't solve it. Research has linked high consumption of ultra-processed food to inflammation and to chronic diseases, including type 2 diabetes and heart disease and Alzheimer's disease. Yet researchers and federal agencies still lack a common definition, federal definition of ultra-processed foods.
Well, it all comes down as the Trump administration faces backlash over multiple foodborne illness outbreaks. Joining me now, Calley Means, a senior advisor at the Department of Health and Human Services. Good to see you, Calley.
Great to see you.
Yeah, it's great to have you here. I think all of us can agree that processed foods, well, you know, they're not the best for us. So what exactly does this announcement do?
Yeah, so what happened today, GRAS reform, is widely regarded by the left and right as the most important food regulatory effort of the past 30 years. This is what everyone has been clamoring for. We got it done today. The real issue here is that the FDA commissioner, as we sit here today, does not know what's in our food. Most Americans, most moms would assume that the ingredients in our food have been subjected to safety studies. That is not true. For the past 40 years, the food industry has taken advantage of a loophole where they can generally recognize a food as safe, GRAS. And 95% of food ingredients now in our food supply have been self-identified as safe with no safety studies. Once you designate that loophole, you do not have to submit the ingredient or safety studies to the FDA. And that loophole use has led to the FDA not knowing what's in our food. It could be 2,000 ingredients, it could be 10,000, we don't know. There's not safety study in our food. So what this does today is it mandates that the food industry for new ingredients, radical concept, needs to notify the FDA, and the FDA will now be able to conduct safety studies on that food. Additionally, for the ingredients in our food supply, and we have 10,000 more ingredients than Europe in our food supply, those ingredients are going to be subjected to post-market review. So this is a massive, seismic food regulatory reform. So
basically what you're saying is that FDA oversight hasn't been working.
Completely asleep at the wheel. It hasn't existed. The FDA, 95% of food ingredients are voluntarily designated as GRAS by the food industry, and they bypass all safety studies. When this GRAS rule was made in the 1950s, it says in the regulation that this is for like things like salt and flour, things that we all regard as safe. Mm-hmm. Now you have things like titanium dioxide, the food dyes. Those are ingredients. These neurotoxic chemicals that are banned in every other country, based on resounding science, they were designated as GRAS. They were not subjected to safety studies. That's changing today.
Okay, so that's interesting. So you're talking about the FDA has had a problem for a really long time, is what I'm hearing. And then let's not forget we had staff reductions, you know, in the FDA and the CDC. Everybody was very concerned about that, and it all happened over the last year. And then the lab team that was working on surveillance of cyclospora went from 11 staffers to just 3. So if you're saying there was a loophole, we've had a problem with the FDA all along, and then we had all these layoffs and cuts. I mean, I guess, how do we have faith in our oversight, you know, our system that's supposed to create oversight over our food and our safety?
Yeah, I could tell you that Secretary Kennedy and President Trump were elected with a strong mandate to reform our broken healthcare apparatus that led to us being told by the experts that we should shut down schools and put masks on 2-year-olds. There was a strong, resounding mandate to do that. And I can tell you, coming from the private sector, and anyone in the private sector can tell you, HHS right now has 80,000 employees. And number of employees is not correlated with output. These are broken institutions, and the fact that there have been some staff changes, I think it's insane to conduct that of whether they could do their job.
Well,
on the outbreak,
what about the outbreaks right now? Because people are saying, okay, RFK Jr. is out there saying, eat real food. Yet people are really nervous about buying real food. They're worried about buying vegetables. They're worried about their jalapenos, their lettuce, because so many, 20,000 people are now sick and 2 people have died?
It's funny that you say people are saying that. Who's saying that? Because there's food outbreaks.
Everyday Americans.
Excuse me. There's food, no. You're quoting leading food safety groups that we've just actually released and learned that these are big food front groups. The ultra-processed food companies is funding literally the notes you have right there from the groups. And this is the first year in modern American history where you're reporting about the food outbreaks. Food outbreaks happen every single year. And I'd be interested if you have any statistic or any reporting whatsoever that the response from the CDC and FDA is not best in class, which it is. We are managing yearly food outbreaks very well. There's zero reporting that you have that is not best in class response to that. And it's interesting.
But why
It's
are people
interesting.
getting
It's
sick?
interesting.
Why
you
are
bring-
people
it's
getting
interesting you
sick
bring
and
it.
why have people died, though?
It's so interesting you talk about that.
Okay.
People are sick right now. Voters voted for RFK because 38% of teens are sick with prediabetes. 50% of teens are overweight or obese. We have the highest rates of pediatric cancer, obesity, diabetes, just go down the list, of any group of children of any society in human history. That's why Americans are sick. And it's very interesting. It's
But
very
we wanna
interesting.
know what's
Excuse me,
happening with
excuse me.
this
It's very
outbreak, though.
interesting. It's very interesting that we are talking today about the most important and sweeping bipartisan food safety reform in American history.
Okay.
When 38% of teens have prediabetes, and you have notes there from very questionable sources.
Who's a questionable source?
I see right there. You
Well,
have,
no,
you
I
have
do have-
statistics from groups
Well,
that are
I've
funded
got-
by Big Food, and you want
No,
to
I
talk
don't-
about a yearly, you want to talk about a yearly thing that happens every single year with food safety concerns and not talk about the most
Okay, wait a minute.
important food safety reform.
When's the last
most
time we
important
reported
food
on an
safety reform.
outbreak on our food where 20,000 people got sick and 2 people died?
We have the data. These
What's the
outbreaks
data?
happen. These
Like what?
food
What are the
safety
outbreaks?
outbreaks
Just tell me
happen
the other outbreaks.
substantially.
Tell
you
me
want
the
to go
other
through the
outbreaks.
history of what's happened
Yes,
during
tell me
Biden and
some
what's
other
happened during
outbreaks.
other. There's food safety outbreaks every single year. This
Tell
is
me
the
the
first
outbreaks.
time.
Tell me the
This is the
outbreaks.
first time in history where you've gotten the notes from God knows who on talking about this instead
Well,
of
I've got
talking
Jerome
about
Adams,
instead of
who
talking
served as
instead
Surgeon
of
General
Jerome
during
Adams
President Trump's
is-
first
Jerome
term,
Adams
and
is
he
a
said there's
charlatan.
mixed messages
Jerome
going
Adams
on.
Jerome Adams is a paid operative to attack the Trump administration and a charlatan, not respected by anyone in the building.
He served under Trump.
And he
How's
is,
that a
he
paid
is a
operative when
paid
he
operative to
served
attack
under-
President Trump, and he's a charlatan. It is very interesting that on the day that we have the most significant food safety reform in modern American history to
Okay.
address the chronic disease crisis, which is the real reason Americans are sick. When we have real food purchases up 7% in the past year, the greatest increase in American history, in modern recorded history, and Americans are buying more whole food, less ultra-processed food. When we have, for the first time in modern history, obesity rates going down because of potentially GLP-1s, but also because of this cultural this revolution happening in the country due to RFK and due to the MAHA movement of people eating healthier food. All of these things are happening, which we're highlighting today. We've taken soda off of SNAP.
No, we're
we're
not
changing school
arguing
lunches.
things like
and
that.
all you
No,
break your
that's-
neck. You break your neck to
No.
talk about an annual food outbreak. It's so interesting.
Okay,
it's
no,
very
no.
interesting. That's
no,
what your
no.
notes
No,
have.
you're
Who gave you those
no.
notes?
You are twisting.
Who gave
First
you those
of all,
notes? Did not talk about
first
the.
of all, I have
those notes
lots
could
of
say,
research,
Those notes could
and
say
I
that
have questions.
Those research could talk about the 38% of teens who have prediabetes who we are fighting for in this country. That
we do
research could
stories
talk.
on that. We
research
definitely
could
do
talk.
lots of stories
that
on
research could talk.
But you're
Excuse
not
me, that
talking
research
about
could talk.
cyclospora
that-
right now. You're not talking. No. You're talking about all these other
Is there
outbreaks,
one-
but you're not telling me the name of the outbreaks.
Is there one data point that you have that we don't have best-in-class responses to those outbreaks? Do you have any reporting on that?
No, what I'm asking you is what's being done right now to make sure our vegetables are safe. People have been very nervous, and we've interviewed people in grocery stores. We've interviewed the heads of grocery stores. People are talking about it when they go. They're
would refer
asking
you-
about the lettuce. They're asking about the
talking to those people?
jalapenos. They're asking about the tomatoes. Yes, we have
see,
reporters that go out into the grocery store.
What's happening in that? I would refer you to the comments of Kyle Diamantis, and I'd refer you to the comments of Jay Bhattacharya and the CDC, and I'd refer you to the career officials who are talking every single day about the best-in-class techniques we are using to address the annual outbreak of various foodborne diseases. I find it very interesting. I find it very interesting that on the day we are talking,
I'm just trying to get answers for the American people.
On the day that we are talking, the American people sitting around the kitchen table.
We aired RFK Jr.'s press conference. No, you're cutting me off. I'm going to take control here. This is my set. This is the
American
interview
people
with you.
are concerned about their kids being pre-diabetic, being obese, about the skyrocketing rates of chronic disease.
And we are handling. They're concerned about their vegetables too, Calley.
And if
why
you
do
have
you deny
one
that?
statistic,
Are you denying that?
Absolutely not.
Do you think that Americans are not concerned about their vegetables?
I'm not denying that. I'm saying we have best in class because it is interesting and I think very noticeable to Americans that on a day we're talking about historic food policy reform, you are breaking your neck to talk about a couple diarrhea cases.
We can talk about two things at once. We can talk about the fact that this administration is doing things about ultra-processed food. I mean, I'm thrilled as a mom because, there's cereal I don't let my kids eat.
You broke your neck within 60 seconds to change the topic
to
what the talking points you have there are.
No, I have talking points about everything. We set up talking about the new rule.
Well,
we talked about him touting the changes. HHS Secretary Robert F. Kennedy, we played a soundbite from the press conference. We took it on our network. We aired all of that, Calley. I'm trying to ask you, in addition to processed foods, which, yes, we all know they're bad for us. It leads to obesity. It leads to all kinds of horrible things that kill us if we eat processed foods every single day. I'm talking about fresh vegetables. There are everyday Americans, even me. I'm sure your family has called you and said, Calley, when is it okay to have lettuce? Is it okay to get tomatoes? Should I go to the farm? Should I go to the grocery store?
You said you're a mom. You say you're a mom. You are completely ignoring, based on the talking points you have in front of you. Let me tell you what we're talking.
These are not talking points. These are questions for you. Here we go, Calley. I'm going to read you. Everyone can see my question here. I'm going to throw out a recent CBS poll last month. Found that nearly half of respondents say that they have not much or no confidence in Kennedy's FDA to handle outbreaks. What do you say to those critics?
So 50%.
And how are you advising RFK Jr. in this moment?
What I'd say is that RFK is the most popular and trusted public health official in America of either party. That 50% is the highest any person has in this country. This is a divided country. RFK is the most important and most trusted by many measures and most popular public health voice in this country. We have a divided country. I think partly because instead of talking about the chronic disease crisis and the incredible accomplishments today, you break your neck to talk about some other issue. You break your neck to talk about how something divisive.
So unfair.
No, it is true.
Unfair.
It is true. You have no concept of scale. You have no concept of scale. We have hundreds of millions of Americans.
All right, you can tell that
hundreds
to
of millions
the
of Americans
20-plus Americans that have gotten sick and the families of those that have died.
There's hundreds of millions of Americans battling with chronic disease.
Yes, that's true.
We have best-in-class procedures on this topic, as you're welcome to talk to the CDC or FDA about, on the outbreak, which happens every single year. What the Trump administration did today is said they had the political courage to take ultra-processed food out of schools and put more real food in, which is going to save thousands of lives. We talked about how we've worked with states to take soda and candy off of SNAP. We're working with med schools to mandate nutrition education for the first time. We're changing the grass, and we announced that we have submitted an ultra-processed food definition. These are things that handle the big issues. These are things that handle the fact that we have the highest rates of autoimmune conditions, cancer, diabetes, Alzheimer's, and every other chronic disease in the country. That's what Americans are caring about, and that's what they're voting about. You took this segment and immediately, based on your notes, went straight to this outbreak, which we've answered 1,000 times.
No.
If you have any concerns about the outbreak, not best in class, but I think this is what I think this is why Americans. That's why we asked you. That's why we asked you. I think this is why Americans actually have lack of trust.
Calley Means, thank you. I appreciate your time. I really do. We're going to get to our doctor now. Let's go ahead and bring in Dr. Darian Sutton. He's a board-certified physician. So, Dr. Sutton, what do you make of the interview with Calley Means? What he just told me. Your thoughts as a doctor.
I think that sometimes when you get so thick into the details, you forget the reality of what people are facing each and every day. People are fearful about their food products. They're asking me in the emergency room what's safe. They're asking me out in the street what's safe because they see our reporting here. We also know that when we compare this year to last year, we've seen a significant rise. And just as an example, the number of cyclosporiasis cases. And that's likely due to a variety of factors. Our complex distribution system, the warming temperatures that are allowing these bugs to thrive and survive on that transport transport. And then we also are having difficulty in containing this as federal regulations and the oversight that has typically been utilized to help to contain these outbreaks is seeing a deficit in human resources as well as staffing and funding. And all that combined, that leads to what we're seeing today, which are thousands of people with sicknesses, with illnesses associated with the food products that they've eaten, and we're trying our best to track and contain that. What I would say to the people at home is that the good news is that when we're looking at these numbers and we're talking about these numbers, we're often talking about food that has gone through the food system already. So that's the way that we acknowledge what has happened so that we can figure out what are our risks in the future. And right now, I would advise parents to pay attention to those recall lists as they're continuing to be updated when you are shopping in your grocery store. I wouldn't want people to walk into a grocery store and feel terrified about the food that they're about to eat, but I would want them to hold a level of caution given what we're up against, which are rising numbers of foodborne illnesses and reductions in oversight.